I've gotten like a bunch of different people asking what to do about different kinds of back pain clients. But the one common theme is, for me anyway, is that we should really know what not to do. um, if you know what not to do, you can work backwards from there. So we have a lot of back education, including in the 800 hour. We deal with that. We just did that last module, but and the one before. But the main thing is what I've seen like online, and then some people are referencing. They're like, "Oh, my client had sciatica, or my client had this or that," and I saw these exercises online that are good. Let's say, my client had sciatica, and I gave him these exercises that were good for sciatica, or my client had spinal stenosis, and I gave them these exercises, or my client had spondylolisthesis, and I gave them these exercises. A lot of the times, those exercises you find are wrong, and I can't really tell you why, other than you free speech is powerful, and people can say whatever they want. But just a couple basics, especially people in the foundations program who are just getting going. So it's important, to get, the best thing is to always get a diagnosis, which you can't do, but a doctor can, a specialist, not a PCP. And that usually comes with pictures, like an MRI. And those are really useful, and probably one of the top 3 awesome contributions of Western medicine is being able to take pictures of things and see what they look like. And the reason you don't have to be able to read the pictures, but you want a diagnosis like, oh, we see a bunch of bulging discs, or, oh, we see spondylolisthesis, which is basically the slipping of a vertebrae, or we see spinal stenosis, which is like a narrowing of the canal, so it squishes the nerve. Because each one of those comes with contraindications or things that'll likely make the problem worse. So an example of that is if you have bulging discs, you generally don't want to do anything that involves forward bending, and that also includes twists, because most people forward bend a little when they twist, and unless they're very body aware. So you want to be careful with those, versus in spondylolisthesis, that word is very difficult for me, and they should have named it something else. But it basically means one vertebrae, I'm trying to give you a good picture, is slipping usually forward over the other. So you've got, instead of your vertebrae stacking, you've got one slipping. And in that case, forward bending would be better for it, but you don't want to bend back. And sometimes they come together. So you'll have both of those conditions at the same time. So if you get a client, and this is what I just wanted to mention before we start today, if you get a client and you don't know what the problem is, and they have some sort of radiating back pain, like nerve pain down their leg, or sort of spreading all around, and you're not sure what to do, you say, oh, this would be better if you had a diagnosis, but you want to do something. I mean, generally, the best thing to teach people, right, in a pinch is how to extend their spine, like their spine gets longer, and how to do it in a neutral position without their forward bending or back bending. So that's where you would start. So you would look for postural problems. Usually people come in, they say, oh, how I have a, thing in my back, and they're not sitting up straight, and they're not extending, and they probably have a lot of weak muscles. If they're acute like that, you can't just muscle test and be like, oh, your hip flexors are weak, et cetera, et cetera. You have to kind of stabilize them in a neutral position first. So that's what you would do. And then you would sort of wait to figure out whether you need them to go forward or back. But most likely, in any big back pain scenario, at least in the beginning, either bending forward or back is going to be contraindicated. So if you don't know which way is, you have to be very mindful. If you want to do no harm, think about neutral. So Tadasana, neutral, side plank, that's all dicier, but if the person's in better shape, their spine is still neutral. You could do exercises sitting on a chair in neutral. But if you lie them on the ground, for instance, and they're in a back bend, and you have a condition where that's contraindicated, you're going to make their symptoms worse. Same with the opposite. So if you're pulling their knees into their chest, you think, oh, this is great. I'll just roll their spine on the ground in apanasana or whatever. The problem is that you're doing constant flexion, constant forward bending of that spine. And if they have disc problems, for instance, you're making them worse, or you're likely to make them worse. But you can't just go online and be like, oh, I found you 10 cool exercises for spinal stenosis. Just 5 minutes before I logged on here, I just did a quick tour of those things, and I immediately found many movements that make no sense, like many movements that I would say are contraindicated for that condition.